All right. Here we have another J.R. Gladden member virtual interview. And I'm Alvin Jones. I'm a pediatric orthopedic surgeon. I work at Dayton Children's Hospital in Ohio.
I'm Jamil Kendall. I'm a PGY4 at Oregon Health and Science University in Portland, Oregon. And today I'm happy to welcome with us Dr. Letitia Bradford. Dr. Bradford completed her undergraduate studies at UC Berkeley, where she majored in physical education and graduated with a Bachelor of Arts. She stayed in the Bay Area at UC San Francisco for medical school and for orthopedic surgery training, where she was the first Black female resident. Throughout her career, she has worked in underserved communities as general orthopedist in different areas, including California, Mississippi, and New Mexico. Dr. Bradford is a founding member of the Artemis Medical Society, a professional networking group for African American women, and has served as chair of the orthopedic section of the National Medical Society. She is currently the executive director of Inventions. Thank you for joining us today, Dr. Bradford. Very
Thank
happy.
you for having me. I sound really smart, huh?
You
it always amazes me when somebody reads my resume. I'm like, man, she sounds really smart.
you proud.
Yes.
So tell us a little bit about, your journey towards orthopedics and kind of how you've gotten to where you are today.
Well, first of all, thank you so much for having me. My path is probably not that different from many others in medicine and in orthopedics. I knew I was interested in medicine in general when I was a junior in high school. So the whole I want to help people thing. I just really liked the science part of it and the tinkering part of it. I mean, and really it stems from my biology teacher, my AP biology teacher in high school. She had us do a rat dissection, and I was the dissector actually and it was a film that we produced. And I really liked the tools in my hand. And so I thought, well, this is kind of cool. Maybe I want to do something in, a surgical field. And then I got to UC Berkeley undergrad, and I was a basketball player. I played on the what was our club team level, and I tore my ACL. So very similar to most people. I tore my ACL, except that my doctor was not nice. He actually was kind of mean. And part of it was I was very interested in what he did and how he fixed my knee, but I also thought that, man, this guy is a jerk. I could probably do a lot better job from a bedside perspective than this guy. And so that kind of fueled me to kind of start thinking about orthopedics. I attended a summer program at the time called the Minority Medical Education Program, which is now called, I think, SMDEP at the University of Washington. And my mentor for that summer was a female orthopedic surgeon. And she was a joint surgeon. And I spent the summer with her going to the operating room and going to her clinic. And I was just amazed at how her patients loved her so much. Like they were so excited to be able to do basic ADLs and to dance and to play with their grandchildren. And I thought, this is pretty amazing. Plus, it helped that I was a super tomboy. So we were in, scrubs, we were in pajamas, our hair were in ponytails, we were in tennis shoes. And I was like, this is great. This is for me. And power tools and saws and drills and stuff. And I came back from that summer going, okay, this is what I'm going to do. I'm going to be an orthopedic surgeon. And of course, I immediately got slapped in the face with the fact that orthopedics is mostly white and mostly men. And the advisor, so at this point now, I'm in college, I'm like, orthopedics, raw, yay. I get to medical school, I'm still like orthopedics. And the medical school advisor at UCSF was like, no, I don't think so. Are you sure that you're smart enough to be an orthopedic surgeon? And I was like, I mean, I went to Berkeley and I graduated pretty highly, I think I'm pretty smart. And he was like, are you strong enough? You got to be really strong to be an orthopedic surgeon. And, I was a basketball player. And so I was in the gym. I was, relatively fit. And I was like, plus Dr. Garai, who I spent that summer with, was literally 5 feet tall and like 100 pounds. And I was like, she's replacing hips. Like I saw it be done. I know it can be done. And so I was like, yeah, I think so. And then he said to me point blank, your people need pediatricians and family practitioners. And I was like, I was like, my people, like my female people, my Richmond people, like what kind of, and then I actually had at least the enough nerve to say back to him, but you know what, sir, my people also need surgeons. They also need orthopedists. They also need people that will listen to what they need and to be able to take care of them where they are. And so, you know, I still think this is what I want. And so I just kind of pushed through that negativeness and you know, I was actually pretty shy initially, and I've become more emboldened with time. But I told the chair of the department at UC San Francisco at that time, I said, look, I'm not going to be your smartest resident. I'm not going to score 100% on all of the exams. I said, but I'm going to be the resident that you want to take care of your family members or to take care of you, because I'm going to do the best job at taking care of you. And he kind of laughed at me, of course, but they took me, they let me in. And so, and so I just kind of, you know, pushed through that. And it wasn't an easy road because, again, being the first, the only, the different, as most of you guys know, it's hard. It's hard being something other than they're used to seeing and dealing with. And I also had a kid at the time. So I had a 3-year-old. So I was coming into residency with a child. And then, you know, through residency, I went through a divorce. And now I'm a single parent with a child. Like, they were just like, what did we sign ourselves up for? And, you know, one of my biggest supporters, initially, you know, he was like, you know, I didn't want you here. And I was like, thank you. And he was like, he's like, I didn't want you here because I didn't understand. I couldn't figure out how you were going to do this. Right. And he's a white male, French Canadian, actually, orthopedic surgeon. And he said, but after working with you for now 6 months to a year, I realized that you're the most organized individual I've ever met in my life. Like, there is no way that, like, you have everything not necessarily scheduled, but you have a map and you have a roadmap and you have an idea of how you're going to get things done. And that's how you do so many things. And so I'm so impressed. I can't imagine, like, you know, what our program would be without you. And I'm really glad we took you finally, right? Even though initially I will tell you that I didn't think you could make it. And I was like, okay, well, all right. We came back to the compliment, so I'll take that. And then he ended up leaving and going somewhere else. And that's when I kind of started to get into trouble, because I didn't have somebody, you know, in those rooms, in that behind the closed doors, that was fighting for me. And I think that really is what makes a big difference for students, especially students of color, when you're the first or the only or the different, is that you've got to have somebody behind those closed doors that is saying, you know, oh no, that facial expression isn't her wanting to kill everybody. It's that she's tired, or that she's, you know, she's just dealing with a little bit of stress, or just, you know, not necessarily cut her any slack. Like, I never asked for special favors for anything. Like, I never asked to leave early because I had a kid. I never asked, you know, to not take a particular call because I had a kid, or because I worked just as hard as everybody else. But, you know, at some point, somebody's got to be there to fight for you and for kind of what you're doing when you're not a resident, even though most people think that's all you are, right? You're a resident 150% of the time. So how could you be anything else? How could you also be a mom? And how could you also be a, you know, so it was tough. The last couple of years of residency were tough, but I made it, and I'm here. So
and you know, it's interesting you say that, because, you know, you've gone through it without the support. And, you know, I had the opportunity to meet up with you at the AAOS and kind of see what you do right now for a lot of the youth who want to be in our shoes. And it seems like you are giving them more of that support and more of that reaffirmation, I guess, that, you know what, yes, you can do it. You know, you may be the first, but, you know, I was able to do it without support. I'm going to make sure that you feel supported so that they can continue on in their journey. And, you know, I really enjoyed working with those medical students. And I thank you for all that you're doing with them. But kind of give me an idea of how that evolved and how you became involved with the Nth Dimensions.
Sure. So there's a few of us out there that say that we were Nth Dimensions before Nth Dimensions had a name. So I was fortunate enough to go to an academy test prep course. And I think I was only like a third year or fourth year, but I was like, again, this plan of mine to be very goal directed and organized was like, okay, I'm going to get on studying for the boards, even though I'm a third year. And I saw a group of Black people sitting together, and I had never, ever seen, first of all, more than one or two. I mean, we had 2 Black men in our program, but we didn't have any Black faculty at all. And so seeing 5 people together, I was like, who is that? And one of them was Bonnie Simpson Mason. And at the break, I went up to them and I said, I don't know who you people are, but I need to meet you and I need to know you. And at that point, she really kind of took me under her wing, and she was like, okay, do this, don't do this. Okay, they're saying this. Okay, this is the documentation that you need to show and prove that you've done this. And, there were certainly times where she's like, look, you're not doing what you're supposed to do. Get it together. Like, so a little bit of tough love, and then lots of support, lots of tears. And, as some people probably know or don't know, she was unable to continue practicing orthopedics. And so she kind of took all of that knowledge that she had of going through the process, and she funneled it into nth dimensions. Like, if I had had just a little bit of support along the way, right? How, not easier, but how more less mind-filled would my path have been, right? Could I have avoided some things that are common practice that I just didn't know? Because we all know that there's a hidden curriculum, that there's a game behind the game. Mm-hmm. And if you don't even realize you're playing the game, then you don't know how to avoid the things that are going to get you in trouble. And so, so she really funneled that into nth dimensions. And I've been a mentor with nth dimensions for the whole time of its inception. And then when she took on a bigger role at the ACGME, she was like, look, I want you to run nth dimensions. And I was like, wait, what? She was like, you're already doing all the work anyway. So why don't you come in, take a little bit more of a role, and really kind of, you know this path, you know what it's like, and you know how to help these kids get to the next level. And so, I'm not going to go away, but I want you to kind of come in here and take this over. And it's been incredibly large shoes to fill, because Dr. Mason is like Dr. Mason. And so, I hope it's been a year and a half now. And so I think I've put a little bit of a different spin on it, but still going forward in a really positive direction. We had one of our largest cohorts this past year. We had 42 students, of which 35 of them were orthopedics interns. And, we had to completely pivot and shift with COVID. Our program is an 8-week in-person mentorship program, where you spend time with orthopedic surgeons across the country. You go to the operating room, go to clinic, learn how to, navigate your day, right? And then you do also do research, and you get to know the orthopedic surgeon with the hope that that person becomes an advocate for you, right? They become somebody for you that can fight for you behind the doors. And kind of get you where you need to be. And it's a longitudinal program. So it's not just a one and done. We don't see you for the summer and then good luck. We'll see you when you're, practicing orthopedic surgeon. We really do continue to follow the students and support them along the way, through STEP, through the match, through picking a practice, through fellowship, through all of those things, through contract negotiation. So
I wasn't aware of that. That's amazing.
Yeah. No, and it's funny because people say, oh my God, nth dimensions is so, it's great, but it's so expensive. And I'm like, well, it's expensive because it's not just a one-time thing. It really is the length of your career. And the goal is that you come back and then be a mentor. You come back and help a student behind you that, you see something in, or that, and a lot of times it's taking these students from places that programs don't think about, right? Because we know that there is value and wonderfulness in all of the schools, in the HBCUs in the system, in what are considered lower tier programs, right? There are diamonds in the rough and gems that are there. And so the goal is to take those students, give them just a little bit of extra specialness, right? A little bit of what we call secret sauce, and get them to be on the forefront of being recognized and noticed. Like, wow, I didn't realize there were these gems at these places. And, I didn't realize that, being a president of a fraternity, of a Black fraternity or a sorority, was totally different than a white fraternity or sorority. Like, it is night and day difference, right? It is leadership. It is community service. It is it is grit, it is multitasking, it is all of those things. But if you don't understand that a Black fraternity and sorority isn't about just partying, then you don't understand that that is a whole different level of leadership. Right. And so it's taking those students and kind of saying, hey, look at this, right? Look at this. And unfortunately, we also have to tell people that the University of Puerto Rico is an actual U.S. medical school, and that you must remember that that these Puerto Rican students are American citizens and are U.S. medical students, right? You would not think that you would have to remind intelligent orthopedic surgeons that, but we do. Like, I've had people go, oh, but they're an FMG. I'm like, they're not, though. I'm like, Puerto Rico is in the United States. It is a U.S. territory. So, and the kid is from Miami. So, it's just interesting. And, being in these rooms where so now I'm in some of these rooms where things happen, and I'm kind of like, God, if I had only known that this was what they were looking for, this is what they were thinking about, then I could have not necessarily lied, because you never lie, but I would have tailored my application, right? Or tailored my experiences to highlight those things that they're looking for. And so I think that's part of what this is. We all have so many, even Jamil, as a resident, you have so much information that you already know right now that you can pass on to somebody that's either an intern or to somebody that's a medical student to get to, because you're where they want to be, right? And so that's the giving back part, the lifting as you climb part, really. I have one of our students who he is, I think, a third or a fourth year at Meharry right now, is interested in orthopedics. He gives Nth Dimensions $5 a month. And it seems like it's nothing, right? But that $5 a month over time builds into something. And it is the commitment that he has shown to us because we committed to him. And he's from Prairie A&M. So he's like from a smaller school where people wouldn't really have paid attention to him. And now he's at Meharry, which is an orphan program. I really don't like that word, but is at a program that has no orthopedic department, right? So he doesn't have an orthopedic surgeon that he meets with on a regular basis to tell him, okay, this is how you present a patient. This is how you think about looking at x-rays. This is how you do the research on this. And so Nth Dimensions is one of the only ways that he has the opportunity to get to know how to play this game. And the fact that, and I tell him every time I get his little $5 notification, I say, you are what this is about. You're about giving back. You're about knowing that this is something special that you received, and it's one latte for you a month that you don't get to have, right? But it's something that means that you're committed to us. And so every time I see that little $5, I get a little touched. So
yeah. And I think he was there at AAOS, right?
He was.
Yeah, I did. I got to meet him, and yeah, we've continued to connect. And so, yeah, I mean, that is the value of, the program. Puts you in front of people, even if you don't have that at your home program. So yeah, absolutely. I'm definitely a huge fan. And, I told all the males at the Iron Sharpens Iron forum that
I really wish I could have been there. Yeah.
I told them that, what I would have wanted to know when I was probably in your shoes or at your stage was that asking for help is not a sign of weakness.
Correct.
And I'm one of those individuals who had to learn like the hard way because I went it kind of alone. And, I missed out on a lot of opportunities and things like this that would have really, I think, pushed along my, career and, helped me avoid a lot of traps and blind spots that I didn't know. So, this is very valuable. I appreciate it. I wish I had, the awareness to have been a part of it at my younger stage.
I mean, think about it. You were taught, and we all were taught, put your head down, work harder, just focus on your goal, right? And don't try to distract all the noise stuff. But if when Dr. Mason says that that isolation is the kryptonite to successful matriculation. Yep. Because what happens is if you put your head down and you just work harder, nobody knows you. Nobody understands what you're doing. And you're really this person that's over there, right? And what you're trying to do is get them to see you as somebody that's over here, that's part of the group, that could be part of the family. And if you have your head down and you're so focused on just doing well on one particular thing and nobody has any inkling of who you are, they're going to be like, oh, that Alvin Jones guy, I mean, he came every day and he worked really hard, but I mean, I don't know. I didn't get a good vibe from him, right? I didn't feel like he fit. Because nobody actually you didn't take 2 seconds to get to know somebody and to connect with them on a human level that lets them know, even though I'm a little bit more tan than you, I'm pretty much exactly like you. Like, so I go to the gym like you do, or I like sports like you do, or I don't like sports like you do, whatever it is. And there's more alike to us than there is differences between us. And so we've been really stressing that the last year, because that whole put your head down and isolate, especially in COVID, has really been hurting our students, because they don't have the connections. They don't have somebody that can pick up a phone and be like, hey, this Kendall kid is actually pretty good. You should take a second look at him if you haven't, because, he's got this and he's got this and he's got this. And so, we've been talking to a lot of residency program directors about how things are going to change with step 1 going to pass fail now, and how that's going to, the worry that it's going to go back to the pick up the phone and call who you know kind of activity. So that worries us a little bit. And so we'll see, especially these kids that come from a Meharry that doesn't have an orthopedic program, and they don't have somebody that can, make a phone call for them. So, the idea is, again, the longitudinal. I got you for the summer, and we did one project together, but hey, I have another project. You want to do this while you're in school? And hey, no, we're continuing to be in contact. And now I met you as a second year, but now you're a fourth year. Now I've known you for 2 years. So now I can, I know Dr. Crawford, who is still on the board at blah, blah, blah. I'll call him and see, if he'll take a second look at you, or if he'll at least give you an interview and get a chance to get to know you. And so, and we do a lot of, how do you present yourself properly? How do you get your lighting properly? How do you make sure you have a good camera so that people can see your facial expressions? How do you, what is your not correct, but, what is a good way to highlight your leadership and your grit and your fortitude in these conversations, so we do a lot of that too, especially now that this year's interviews are going to be virtual again. So you don't get the opportunity to go in person to programs. You don't get the opportunity to do the night before, get to know each other stuff, because you're on a computer.
Yeah, that's
gonna. I might need to take you up on some of those tips for fellowship applications.
Yeah. Happy to help anytime.
Yeah. The netiquette for interviews, right?
Exactly. Oh, so now if you see that word come up, I'll be like, maybe I heard that from Alvin Jones, maybe not.
Yes.
The netiquette. I like it. Exactly.
We're coming up on our time here, and I want to make sure that I get a few more questions in. One of the things we like to ask all of our interviewees is give some advice. If you had to think back at the stages of some of these trainees who want to be where we are, think medical students and residents, what is a piece of advice that you would give them at their current stage?
Oh, that's a tough one, man. Okay, there's so many, because I got like 15 things. So I think one thing is to make sure that you are doing the daily studying. Like, we spend a lot of time, in training is in November, and everybody crams for in training, October, right? But if you're doing daily readings, even 10 or 15 minutes, or doing 5 or 10 questions a day, by the time it comes time for you to do in training, you've done, 364 questions times 10. That's a lot of questions. And it seems really difficult, because you're like, how am I going to put anything else into this crazy schedule? But even if you just do 5 or 10 minutes or 5 or 10 questions a day, that makes a big difference. I wish I had started studying earlier. There are some students that are being told as interns, don't study for in training. It's fine. They know you're an intern. That is absolutely not the correct answer at all. 0. and so I think that studying a little bit harder for in training and being able to navigate how in training asks questions I think would have been helpful, because it's all test, not all, but there's a big part of it that's test taking skills, right? Can you break down can you break down the question into really what they're asking? Can you eliminate things that you know are not correct, and at least narrow it down to 2 and then make an educated guess, right?
Yeah, it becomes pattern recognition after a while. Yeah.
Exactly. And the questions recycle. There's not that many questions in the world. Like, some variant of that question that you've probably already seen is going to show up on the in-train. And so, so I think that's the big thing. For medical students trying to get into orthopedics, don't listen to the naysayers. Don't listen to the people that say no. Find somebody, and for every, and somebody said this about us, about Nth Dimensions in particular. I heard 5 yeses from Nth Dimensions before I heard my first no from my program. And for me, that's a huge compliment, because that means that so very similar to my story, I had several people tell me I could do it before I had the one person tell me I couldn't. And so I already kind of was emboldened to know that I could do it, and I'd already seen it. So I already seen somebody that was a woman doing it. So I know it was possible. And then, I attended the program where they said, you can do this. And so I'd already heard 2 or 3 yeses before I heard a no. And so try to find somebody that's going to tell you the yes. It's going to be difficult. That's not the question. And maybe the path is a little bit less straight for you because of those difficulties, but it's still possible to get there. We all know orthopedic surgeons that are 195ers. We all do. Right? And so the question is, how did they get there? What extra things did they do to strengthen their application to get there? And it's possible. And so you just have to find the yes.
Thank you.
And one other question, from the resident standpoint, you talked a lot about that lifting as we climb, and I think that's really important. What advice do you have for residents who are wanting to, be better mentors to younger residents, to medical students, ways that we can do that most effectively?
Well, I think part of it, again, is understanding the information that you have and how you have information that they don't have, right? And so that's part of it. And I think that it's about, I don't know, there's this big thing where in training tests go around, right? But for some reason, they don't always get to the residents of color, whether that is because none of the residents of color have the test or none of them are sharing the test, right? Share the knowledge that you have. We're not in direct competition with each other. There's room for us all to be successful, and there's room for us all to make it. I mean, there's only 1.5% of us, right? So the niche for us to go into spaces that nobody has gone into, they're there because nobody's going to those places, right? And so we're not in competition with each other. And I think once you realize that and you learn to work together synergistically to get to the end, because if you both succeed, then you're doubly successful, right? So you have information already as a 3rd year or as a 4th year that an intern doesn't know. Like, hey, that doc likes this way to drape, or that doc, be sure you know this information for that doctor because he always asks that question. That's helpful. And so passing on the little bit of information you have, if you have tips and tricks or in training exams, share them. Work together. Hey, this is what I learned. This is how I did it wrong the 1st year, but here's how you can do it better. Not necessarily right, but do it better. And that's what it's about. It's all about getting better so that we all successfully get to the end of this, because that's what makes our communities the most successful, is if we all succeed. So.
All right. Well, the final question that we usually like to ask is from a J.R. Gladden Society. How can we support you better as a society?
So it's interesting, I grew up in Gladden as well. So I have been, Dr. Morgan was the NMA president when I was like the SNMA regional director. And so, I grew up around Gladden. I went to NMA and presented as a resident. So I literally have come up through the ranks, right? And I think part of the wonderfulness of Gladden is seeing all of the Black surgeons. Because again, where you are, you're maybe one of one or one of two, and going to the Gladden luncheon and seeing a room full of intelligent Black orthopedic surgeons is the highlight of every academy meeting, for sure.
It's always inspiring.
Oh, always. And so seeing that, number one, is the most important thing. Seeing it, you have to see it. And so being able to get our students there and getting these medical students and residents there to see that the goal is obtainable for them, I think is very important. Obviously, Nth Dimensions and all of our residents and students, they need support. They need financial support. They need physical support. So we need mentors. We always need mentors. We always need people that will help with webinars. We always need, and even residents, we have residents that talk to our medical students through the process. And so getting involvement of your time as well is super important for Nth Dimensions. And if you don't have time and you have an extra $5, give an extra $5. So, awesome. Because again, it all helps. It all helps to support the students along the pathway. You know, think about, you mentioned asking for help is not a weakness. Part of what we do is we have emotional and mental wellness support for the students that we pay for out of our budget. And so being able to even give something to support the wellness program for the students is very helpful. I mean, the stress, I mean, it's different. Like everybody's like, oh, back in my day, we didn't have that, or we did this instead, right? These kids are this or they're that. The stressors are different. And so getting them through those stressors with professional support sometimes is necessary. Mm-hmm. We have a lot of kids that have unrecognized ADHD or unrecognized test-taking disorders mm-hmm. that they don't have. A student told us the battery test to prove that they have a learning disorder was $3,000. Can you imagine, as a student, if you don't have $3,000 to prove that you have this test-taking issue, you're never going to get the services and the help that you need. Right. And so it makes you wonder how many kids out there are undiagnosed because they don't have $3,000. Right. And so, giving of that kind of stuff to be able to help, or resources for that, are incredibly helpful for our students. And really, as Black orthopedic surgeons, we just all need to we're in this together, right? Mm-hmm. And so working together, we're all interconnected, whether we want to be or not. We're all interconnected with each other. And working together to be supportive of these students coming behind us to fill our shoes is incredibly important. I'm not a young surgeon anymore, but I'm not old quite yet. But I definitely know that we need to get these young people in to replace us and to take over some of these roles. And so anything you can do of your time, of your finance, of your resources is absolutely tantamount to us and the students being successful. So awesome.
And go ahead and plug the link. Where should they go?
So Nth Dimensions. So right now, actually, we're about to open up for first-year medical students. Our application for 2022 summer is about to open up November 1st. nthdimensions.org. We are also on social media at, we're on all of them. We're on Twitter. We're on Twitter. We're on Instagram. We're on Facebook. And I think it's NTH_DIM is for Twitter. And I think Nth Dimensions is the Instagram handle. So find us on all of those resources, and we can absolutely help you. We're working with Gladden to do some webinars coming up in the next quarter to help the students as well. And so we'll be plugging those on the Gladden website as well. So, and awesome. Vice versa. So
great. Well, thank you, Dr. Bradford, for your time.
Thank you so much.
Thank you so much. I appreciate you guys so much for doing this. This is amazing.
Our pleasure.
All right. Have a great day, guys.
You too.
All right. You too.
And you know how to reach me, Jamil. We can get in touch and get you some of that info.
All right. Perfect.
Sounds okay. Good. Have a good day.
All right.